Different types of electronic health records, better known as EHRs, were developed by academic medical centers, the government, and industry. The goal was to compile patient demographics, progress notes, problems, medications, vital signs, past medical history, immunizations, laboratory data, and radiology reports so they can be readily viewed and managed in one place. The first EHR system was better known as a clinical information system. Since the 1980s, efforts have been made to increase the use of EHRs. The Institute of Medicine, better known as IOM, created a report that identified EHRs as one of the 7 key recommendations for improving patient records and proposed a means of converting paper to electronic records. EHRs have appeared in the National Political Forum indicating widespread concerns about record keeping's effect on public health. President Obama incorporated EHRs into his American Recovery and Reinvestment Act of 2009 as a part of the Health Information Technology for Economic and Clinical Health Act, better known as HITECH. The Act provides for higher payments to healthcare providers that meet meaningful use criteria, which involves using EHRs for their relevant purposes and meeting certain requirements. The EHR has the ability to generate a complete record of a clinical patient encounter, as well as supporting other care related activities, directly or indirectly, including evidence based decision support, quality management, and outcomes reporting.
There are several benefits for using electronic health records. The most obvious benefits of EHRs is the access to information, getting clinical information when and where it is needed. As EHRs are implemented, access to health records will be available 24 hours a day, 7 days a week. Access to records and communication are interconnected. Easy access makes it convenient for individual clinicians to get the information they need, as well as improves communication among providers. Data will be better organized due to the location being in one central location, allowing for the data to be only entered once. This will improve the quality of the data entered because it will negate illegible handwriting and allow for less confusion by not being able to read what is written, ensuring the data is complete and accurate. The clinical data will allow for claims processing efficiency by assisting the billing process. Due to the fact that data is electronic and in one location allows for complete documentation needed for claims purposes. EHRs allow for individual provider profiles of performance as well as containing all provider profiles. This allows for quality improvement initiatives. This allows for a better means of storage of all medical documents and charts. Clinical and financial outcomes can be more easily monitored and linked to quality improvement processes. Electronic health records are not an easy or cheap instrument to implement into the healthcare system. Many healthcare providers, especially smaller clinics, have viewed the implementation of EHRs as a hindrance rather than a benefit. The number one issue seen by providers with the enactment of EHRs was the vast cost, from the buying of the software to the enacting the software to the teaching all members how to use it. When President Obama enacted his federal stimulus plan, which required the use of EHRs through the American Recovery and Reinvestment Act, otherwise known as ARRA, many healthcare providers began to worry about how they would afford the new software. Yet, the federal stimulus plan offers a lot to healthcare providers, to the tune of billions of dollars worth of grants. The grants are available to those institutions who already have EHRs in place to allow them to upgrade their systems, as well as those institutions who need to adhere to the new laws. The total grant money the government is allocating toward health information technology is $19 billion. Along with the grant money, there is an incentive payment for Medicare and Medicaid hospitals and providers to begin in the year 2011 to allow for increased care for those who are unable to afford it. The easiest way to apply for the grants is to visit www.grants.gov. This website has seen upwards of 200,000 views a day, with individuals either looking at the website or applying for grants. Due to the high volume of traffic, it has been recommended that healthcare providers only check on the status of their grant every hour as to not crash the system. From 2006 to 2011, the number of providers using federal grants has more than tripled. Healthcare providers who need a grant should clearly examine the types of grants available, how much money they will need from a grant, and exactly what they will need from the grant before they begin writing their grant proposal. By having a clear picture of what is needed, the grant writing is very concise and straightforward, which helps to expedite the approval process. In the private sector, grant writing should be conducted by an individual who is experienced at grant writing. Agencies must ensure they adhere to meaningful use to qualify for federally funded grants. The agencies that generate innovative approaches to health information technology delivery and development and usage of health information technologies will be eligible for grant allocations. Most of these agencies will be educational institutions that need to expand their educational program. The Department of Health and Human Services is the largest federally funded organization that is providing grants to medical institutions who are applying for them. The first type of grant that is available to individuals are mandatory grants. all hospitals and agencies are mandated to obtain a mandatory grant. The name is deceiving, as mandatory grants are available to anyone who applies for them, including private facilities and providers. The Department of Health and Human Services defines mandatory grants as those that a federal agency is required by statute to award if their recipient, usually a state, submits an acceptable state plan or application and meets the eligibility and compliance requirements of the statutory and regulatory provisions of the grant program. Federally funded grants are available to those institutions who provide care for those that are less fortunate. State agencies which provide nutrition to women and children, primarily part of the WIC program, are eligible for federally funded grants. Also eligible are those Indian tribal organizations in which $100 million in grants are available. This has created the ability for these organizations to comply with the new laws and regulations while being able to afford the expensive cost. The grants will provide management information systems such as the mandated EHRs. First Lady Michelle Obama created the Recovery Capital Improvement Program, also known as KIP, which provides $851 million to community health centers. Approximately 1,050 community health centers will receive funding, at the very least $200,000 each, to implement new EHRs or improve old ones. More than 650 centers will use the funds to purchase new equipment or health information technology systems, and nearly 400 health centers will adopt and expand the use of electronic health records. The funding will be put towards expanding computer centers to help manage electronic medical records, adding on new staff, and expanding programs that work.
What kind of technology is involved when accessing and retrieving your EHR data? There are two main sources, the first being server-based storage. In a server-based storage, all computers and locations are connected to servers in your office and work with the data on the server. Practices utilizing this method usually prefer the inherited security that comes within this structure. The second option for retrieving and accessing EHRs is known as Software as a Service, or SaaS. SaaS is currently the most common method utilized in other industries and most accessible for consumers. SaaS is run and accessed through an internet software. Access through any device is granted by entering your username and password. Examples of SaaS can include email or online banking. What kind of costs are involved? Costs will vary depending on the size of your staff, office location, unique office circumstances, and SaaS users benefit from monthly payment subscription structures. Other variables to consider include software costs, third-party costs, and annual maintenance costs.